You go to the doctor, give a blood sample, and wait. Opening a medical test result triggers a very specific kind of anxiety. That anxiety spikes when you're looking at an HLA B-27 RT-PCR test, and the bold red letters at the bottom read positive. Your mind immediately jumps to the worst-case scenario. You wonder if you are facing a lifetime of chronic pain, or if you've just been handed a diagnosis for an incurable disease. But here is what the clinical language leaves out. That positive result doesn't mean you have a disease at all. It is simply a biological identifier. Reacting to that single word with panic is a psychological trap. It happens because we misunderstand how genetic science actually works. Your cells are covered in human leukocyte antigens, or HLA. Think of these as cellular security guards. They actively scan your internal environment, verifying your own tissue, and sounding alarms for invading viruses. HLA B-27 is one specific version of these ID cards, inherited from your parents. There is a massive biological difference between inheriting a genetic marker and contracting an illness. You are born with your eye color, and you are born with this gene. A positive report confirms one thing. You carry a specific genetic ID card passed down through your family tree. It doesn't mean you're currently sick. This grid represents the healthy Indian population. Notice that up to 8% of these individuals naturally carry the HLA B-27 gene. These carriers move through their entire lives. They age, they work, and they remain completely healthy without ever experiencing chronic pain or stiffness. If millions of healthy people carry this gene without issue, we have to ask why doctors bother ordering this test in the first place. The gene only becomes clinically relevant when a patient is already suffering from a very specific set of chronic physical symptoms. Doctors usually order the RT-PCR test for specific issues: persistent back pain, a stiff neck, or eye inflammation known as uveitis. They are looking for specific autoimmune disorders. The main targets are ankylosing spondylitis, which causes spinal inflammation, as well as reactive or psoriatic arthritis. The presence of the HLA B-27 gene is an indicator of risk, not a confirmation of disease. Doctors use it to refine their search, but final diagnosis depends on seeing the inflammatory process happening in the body. No scientist or doctor will form a complete diagnosis based solely on one positive blood test. They rely on a three-pillar framework. First, clinical symptoms, where your pain is and how long it's lasted. Second, radiology, like MRI scans to visually inspect your joints. The final base is blood tests, evaluating HLA B-27 alongside CRP markers to confirm active inflammation. A true medical diagnosis requires all three pillars to align. An isolated positive gene without physical symptoms in clear radiological evidence is clinically meaningless. If your report comes back positive, you can exhale. It is not a death sentence, and it has absolutely no connection to fatal conditions like cancer. If you do have that positive result alongside the chronic pain symptoms we discussed, your next step is crucial. You must choose the correct specialist. Patients often default to a general orthopedic doctor because their bones hurt. You actually need to consult a rheumatologist. Rheumatologists are uniquely trained to decode autoimmune disorders. They are the medical authorities equipped to interpret what this specific gene is doing in your body. Conditions associated with this gene involve inflammation where ligaments attach to the bone. This creates a specific type of pain that worsens during rest and, counterintuitively, improves when the body is moving. By keeping the joints in motion, you are physically preventing the inflammatory process from causing the spine to stiffen or fuse. This makes regular, targeted exercise a physiological necessity for long-term health. Objective scientific understanding removes the need for panic. When you know exactly what your test results mean, you can take control of your health with the right experts and an active lifestyle.